Hello viewers, welcome back to my channel. If you are working in clinical research or pharmacovigilance, you have probably heard of MedDRA. But what exactly is it and how is it structured? In today's video, we will break down the medical dictionary for regulatory activities, commonly known as MedDRA, and understand its hierarchical structure step by step. So let's start. MedDRA stands for Medical Dictionary for Regulatory Activities. It's a standardized medical terminology developed by the International Council for Harmonization, also known as ICH, to facilitate the sharing of regulatory information for medical products used by humans, including drugs, vaccine, and biologics. It was developed in 1990 by ICH for human use. It is maintained by the MSSO, which is Maintenance and Support Service Organization. MedDRA is widely used for coding and classifying adverse events, standardizing clinical trial data, signal detection in pharmacovigilance, and the regulatory submission to health authorities like FDA, EMA, and PMDA. Why is MedDRA important? Before MedDRA, different countries and organizations used different dictionaries, leading to inconsistency and confusion. Hence, MedDRA becomes a solution for this problem. MedDRA provides a single global standard, consistency in terminology, better communication with sponsors, CROs, and regulatories, and enhanced data analysis and signal detection. Now let's dive into one of the most important aspects of MedDRA, its five-level hierarchical structure. Each level helps in organizing medical terms from the very specific to very broad, enabling flexible data analysis. Let's go through each level one by one. The first level is the lowest level term. We are going from down to up. The lowest level term is the most specific level, also known as LLTs. These include synonyms, lexical variants, and common misspellings. Each LLT is linked to only one preferred term, which is also known as PT. When we say it is linked to one preferred term, what is mean is that if the LLTs are heart attack, cardiac infarction, myocardial infarction, all these LLTs are linked to the same PT. Please note that LLTs are what we use for data entries. The second level is the preferred term. PTs represent a single medical concept. All LLTs map to the same PT. PTs are used for data retrieval and analysis. Again, as we have given an example for the LLTs, all those LLTs which we have mentioned earlier, they are related to the same PT, which is the myocardial infarction. Moving on to the third level, which is high level term, also known as HLT. HLTs are the groups of PTs that are related by anatomy, pathology, or function. For example, PTs like myocardial infarction, coronary artery thrombosis, and acute coronary syndromes may all be grouped under the HLT, coronary artery disorders. The next level is high level group term, which is HLGT. HLGTs are the broader group that combine multiple HLTs. For example, the HLTs for coronary artery and myocardial disorders might roll up to HLT cardiac disorders. Next and the last level is the system organ class. This is the broadest level in MedDRA. The system organ class, also known as SOCs, represent body systems or medical disciplines. There are 27 SOCs in total. The example which we are discussing in all the levels here are the cardiac disorders HLT groups, which belongs to the cardiac disorder SOCs. In real world use, MedDRA is updated twice a year, once in March and the another in September. March 1 is a major update, whereas the September one is the minor update. At the time of this video, the current version of MedDRA is 28.0, which was released in March, and the upcoming version is 28.1, which will be released in September. The organizations use MedDRA browsers or software tools like JReview, Oracle Argus, or SAS for coding. It supports multi-axial, meaning a PT can belong to more than one SOC for better analysis. If we want to understand this, I will give you one example. A term like diabetic neuropathy may fall under both the endocrine disorders as well as the nervous system disorder SOCs. Now let's understand how the adverse event, which is the heart attack, will be mapped to the 5 levels of MedDRA codes. Myocardial infarction, commonly known as heart attack, occurs when blood flow to a part of the heart muscle is blocked, usually by a blood clot. This blockage deprives the heart muscle of oxygen, leading to damage or death of the heart tissue. When a clinical report says patient had a heart attack, you don't code heart attack as it is. Instead, you select the LLTs heart attack, which is mapped to the PT myocardial infarction. Different reporters, such as healthcare professionals and non-healthcare professionals, describe the same condition differently. For example, heart attack has a medical term as the myocardial infarction, but in layman terms, it can also be mentioned as heart attack, chest pain, crushing chest sensation. All these LLTs can be standardized to myocardial infarction as the PT, the ischemic coronary artery disorder as the high level term, the coronary artery disorder as the high level group term, and cardiac disorder as the SOC. This ensures standardization and consistency across all records and allow for aggregated analysis under the cardiac disorder SOCs. A term is the variable in the AVE dataset of SDTM. It records the verbatim term used by the investigator or site staff to describe the adverse events, usually as entered in the case report form. The A term is mapped to an LLT in MedDRA during coding. The selected LLT determines the corresponding PT, HLT, HL group T, GT, and SOC in MedDRA. This coded LLT is then stored in AE decode, which is also known as the preferred term in SDTM AE domain. If a safety report uses different LLTs, all are mapped to the same PT. When queried by SOC or PT, the safety database pulls all related reports, enabling thorough signal detection and drug safety evaluation. That is also the one of the reasons we create the SOC by PT tables in AE. That's all for today. I hope this video helped you understand what MedDRA is and how its hierarchical structure works. Don't forget to like, subscribe, and share for more videos on clinical research, CDISC standard, SAS programming, and more. Thanks for watching. Let me know in comments if you want me to cover any specific topic.